PatientsEngage, as a lot of you would already know by now, is an online platform which has been operational for 5 years. We focus on informing, engaging, and empowering patients and caregivers. And today's topic we're focusing on is the challenges when Parkinson strikes young. We are focused on holistic and evidence-based management of chronic conditions from the perspective of patients and family caregivers. We believe in the value of lived experiences and how people can learn from those lived experiences, as well as how being informed improves your feeling of being in control of your condition. And it's also important to be engaged and be proactive about managing your own health issues. We have been doing webinars for 18 months, but in the last 1 month, we've really done a lot many more. And these allow you to interact with people with lived experiences who are experts in their own right, as well as with healthcare professionals. We've covered a wide range of topics. And as we said, today's topic is about challenges of living with Parkinson's when it strikes the young. So today, just to quickly introduce the panelists we have today, and you will see them a bit better after we stop sharing the slides. We have Sunil, Monica, and Raju, who will share their experiences of living with Parkinson's at a young age. And we've got Nicole, who is the head of therapy and research at Parkinson's Disease and Movement Disorder Society. And I'm Aparna, I'm the moderator for this session. Okay, and yeah, so Nicole, let me first hand over to you. If you can just quickly introduce, why it is called young onset Parkinson's and what it is about, and then we'll talk to the panelists.
Sure. Could I have the slide, please? I think I'm still seeing. Yeah. Okay. For those of you, just a bit of an overview on Parkinson's. It's a neurological condition which progresses slowly over time. And it causes changes in your body, which could be related to your movement, to the way you think, your mood, and even autonomic functions like gastrointestinal issues, sweating, blood pressure issues. And all this occurs due to the loss of these dopamine producing neurons or cells in your brain. Most people associate Parkinson's with a tremor or something that they see in old age. But actually, that's a myth because not everyone with Parkinson's has a tremor. And not all people with Parkinson's are elderly or above 60. You have juvenile Parkinson's, which is people diagnosed before the age of 21. But today, what we're going to be talking about is young onset Parkinson's. Can I have the next slide, please? Parna, can I have the next slide?
Yeah, it is. I think you're having a little bit of lag. It's up the next slide.
Okay, fine. So I'm just going to go blind then. Okay, so young onset Parkinson's is basically a condition in which almost 10 to 20% of the Parkinson's population has young onset Parkinson's. It's usually when a person is diagnosed between the ages of 21 to 40 years of age that we call it young onset or early onset Parkinson's. And if you see the person on your right, it is Michael J. Fox. He's an American-Canadian actor, very famous at his time, who developed young onset Parkinson's and is now a very strong advocate for them. So although the symptoms may be similar in Parkinson's, both young and late onset, the experience is quite different. Next slide. So what is the difference between young onset and the late onset Parkinson's that most of us know about? One is the progression over time is generally slower, although they have to live with the condition for much longer. The certain initial symptoms, dystonias or these abnormal postures are more common. We do have less problems with balance, thinking, memory. Dementia is not commonly seen, but they do have a lot of emotional issues as well, depression being one of them. The drugs also can have a little different effect on young onset Parkinson's people. They have things like impulse control disorders, which could be like excessive gambling due to certain medications or hypersexuality. But there are also dyskinesias, which are more likely to develop. With young onset as well, genetics may play a larger role as opposed to the late onset, where environmental factors play more of a role. The next slide is about, and I said it's a different experience because it's the stage at which people get Parkinson's, and things like employment, relationships and marriage, family planning, your finances, being a parent. All of these become bigger concerns for a young onset person. And I think the invitees today are going to talk more about that. And I think their lived experiences will actually help you understand better what young onset concerns are.
Thank you, Nicole. Let me just stop sharing the slide and we can show our panelists so that they are more visible. So I guess, first of all, thank you to all the panelists for joining us to share your experiences. Let's start with, the moment of diagnosis, which is often a difficult moment or an unforgettable moment for Parkinson's patients. And, if you can briefly tell us your initial symptoms that led to you seeking help and getting to a doctor uh, for a diagnosis. So, Sunil, if you want to go first.
Yeah, hi. Can you hear me?
Yes.
Yeah, good morning, everyone. Yeah, so for me, it basically started with, when I would go for my walks, morning walks, I began to feel a little lifeless on my left hand side. And I slowly realized I was losing my arm swing. What also tended to happen is while I was learning to swim, my instructor was saying, keep on the left hand side. Your left side is a little weak. I thought maybe I'm a right-handed person, so maybe that's why the reason my left is weak, so I'm not able to kick. And then I noticed things like my ankles not rotating when I want them to turn, and my leg not landing on my heel, and my leg, moving more on the left-hand side while walking, because normally when we walk, our legs turn to move outside. So this kind of triggered some kind of, I was a little worried, so I saw my doctor first, and he said maybe it's just could be it's playing on your head, and nothing to be worried about. I had no tremors at that time, but then we did an MRI and nothing came up in the MRI, so he asked me to see a neuro. And when I told the neuro the symptoms that I just mentioned, he said it's Parkinson's, early stages of Parkinson's.
Right. Right. Okay. Um, Monica, do you want to, just for everybody before, Monica, before you go next, this session is getting recorded, and people who are on Zoom, if you would like to ask any questions, there's a Q&A button that you can see. You can ask your questions there. And those on Facebook can ask in the live feed comments, and we will try and address them during the session. So Monica, if you want to tell us about your initial symptoms and the stages that led to the diagnosis.
Sure. Good morning, everybody. Actually, in the month of October 2017, there was quite limping, small limping of the leg, which was not very visible. But one of my neighbor just pointed out that I'm limping on the right side. I tried and asked some other people, but nobody could notice that because it was very slight and it was not very often. It was one-off case. I just ignored it, and next year, after 5 months, there was slight tremor on my palm, right palm, and the tremor remained only for 2 or 3 seconds. But since I had noticed it, just for inquisitive purpose, I went and met a GP, but she is a dean in a government hospital. So she was very quick in finding out that there was some problem, and she just referred me directly to the neurologist. And once I met the neurologist at Bethany Hospital, he had mentioned some tests, MRI, CT scan. MRI and CT scan were clear, but he had mentioned Trodat also. And once the tests were clear for MRI and CT, he insisted that I should get a Trodat done. After 15 days, I got appointment for Trodat, and the results were positive.
Right. Okay. Thanks, Monica. Raju, do you want to talk about your experience of the initial symptoms? And I've unmuted you. Yeah.
Yeah. Good
Go ahead.
morning. I
Good
am
morning. Good
Raju,
morning.
69 years. My age is 43, staying at Goregaon, Mumbai, in India, with my daughter Ritvi and my parents. So I'll start my first start experience, how it was. My hand was little shivering and it was observed by my family. So I told that it might be due to blood circulation. While sleeping, my hand goes in, my hand is in my below my body. So sometimes blood circulation stop or might be cold. But it was continuously, when it was observed continuously, my hand was shivering. So we went to our family doctor. Let's see what, let me see what the family doctor. Then we went to family doctor, and when I told him it's a little tremor, I think you go to, he given me the reference of the neurologist. So we went to neurologist. He told me to do some tests, and in the report it found that it is initial stage of Parkinson. And the symptom which I want to highlight, the symptom which I am experiencing, which I am having my right hand and leg shivers, rigidity is there, rigidity, which fingers get stiff, tremor, slow. I'm having problem with slow walking. When I have to keep small distance steps now, I find more
Hmm.
difficult on walking small steps.
Right.
Uh, that's it for the first question.
Right. Okay. Thanks. Thanks, Raju. So I think as it's quite
Thank you.
obvious from our three panelists that the symptoms range quite a bit, right? So it's from dragging and shuffling to rigidity to limping to tremors to shivers. So I think it's important to understand that Parkinson's is not just tremors, which is often a perception. So coming to your reaction to the diagnosis, and who was the first person you talked about it with, and did you initially have a different reaction, and how did your reaction change over time, or how did you get to acceptance? So Monica, do you want to take that first?
Yeah, sure. Actually, initially, like my family was aware that I'm just looking, I'm just going to different doctors, because as I have already said that initially the MRI, the CT scan were negative.
Mm.
So I thought that it's just waste of time and money, since I am always deficient on certain vitamins in my body, B12 or D3. Something must have something must have triggered this particular symptom. But when
Right.
the doctor said to do Trodat, basically I was not aware of what is a Trodat scan, but the cost itself made me realize that it should be something which is very important. And
Mm.
when I went on the net and searched for what it is done for, like for what reason the scan is done, that time I was a bit nervous. But then too, like, I never thought I would be having it. I thought that even this test will turn out to be negative, and they will just tell me to take some iron shots or some vitamin shots.
Mm.
And all this while my family was included in all this thing. But the moment the Trodat was done, and after 3 days the result came out, my husband was the first person to know about it, because the call had come on his phone and they had called him immediately ASAP,
Right.
like there is
Right.
something very important. And he just left a particular meeting because the person had forced him to leave immediately. So
Mm.
he left a meeting, he went over there, he came back, and he just told me very casually that there is some problem and it's Parkinson. So
Right.
initially I didn't react much because I was not aware of it, what exactly it is. I had just learned as a, not actually as a subject, but a paragraph in my school days.
Mm.
So I just know that it's a tremor and it's a old age disease, only this
Mm.
much. So I was sure that there was some problem in the report. The report is wrongly done or somebody else's report has got exchanged. And then we contacted the doctor again and he said that he has tested it twice to be sure since I was young.
Mm.
Even they had their own doubt, but it was positive. So like there was no denial as such. But then I was, for initial 2 days I was okay, but after that when the disease, the, I mean, what can happen to me and all got sunk in, it didn't get sunk in immediately, it took few days. But after that, like I had lot of psychological issues. I tried to find out the reason why it could happen. I was trying to shift those problem on somebody else's deeds or behavior or whatever. But
Right.
then it took quite some time for me to realize it makes no difference how I got or why I got. I should better start moving and find out what can be done now.
Mm. Mm. Okay. Thanks, Monica. Um, Sunil, do you want to kind of also tell us your reaction to the diagnosis and, how did you handle that?
Yeah, surely. So basically, when the doctor said it's Parkinson's, I was a bit shocked, but cool at the same time. I never ever dreamt that I could have Parkinson's because nobody in our family does.
Mm.
So I checked with him whether any more tests are required, and he said it's a clinical diagnosis, and he seemed pretty confident. So I said, thank you very much. I'll see you in the next 2 weeks or 2 months. That's what he had prescribed. And I knew Parkinson's had to do with tremor more because that's what we generally know. And I knew it had to do with the brain, and I knew it was a serious sickness. But still didn't kind of sink in. I knew I'd go home and check on Google Baba. Google Baba now has everything for us. So I thought I'd go home and do that. And I went home and told mom and dad, mom and my two sisters, dad is no longer there. And they were shocked and wondering how it could be. That's it. How did I move from shock and denial to acceptance? I think Parkinson comes with the inbuilt anesthesia.
Hmm.
It kind of numbs you and you don't feel too much.
Hmm. Okay. Raju, what would you like to add to that in
Yeah,
terms of your?
uh, as suggested my family doctor to the neurologist. I went to the neurologist. So he told me to done certain exam, like he told me to walk, and then he suggested me to take some certain reports. So
Hmm.
after getting the reports, I saw it was tumor, something was written. So I
Right.
don't know exactly what it was. So I went to the doctor again with the reports and all. After seeing the reports, the moment doctor said you are having Parkinson
Hmm.
disease. So Parkinson, I reacted like that. Parkinson, can
Hmm.
you explain me what it is? So
Right.
he explained me little things. He explained me, and lastly he said this disease is controllable but not curable.
Hmm.
The moment I heard, I got shocked and I fainted and fell on. Again, I sat on chair. Then after 2 3 minutes, they given me water and all. Then I came out.
Hmm.
My wife was with me that time. So
Hmm.
when I came out, I started crying. So my wife seen that I'm crying. Why you are crying? You think about the people who is blind no legs, no hands, mental, etc., etc. These people,
Mm,
you can walk, you can eat, it is controllable now. Then don't worry about the family and all. I will do the job and we will survive it. I'll take
mm,
care of yourself also.
right,
So don't take more stress. It will impact more to your health.
right,
After hearing this, I got little what you call little relax, got little relief, and thanks to God to get such a partner. But the truth is now she left us 5 years back. So I'm myself only make strong myself, and I have the responsibility of my daughter. So I think about her only to know I don't take any stress.
right.
That's it for second question.
Okay, thank you, Raju. I think couple of people are
Thank you.
raising hands. If you have a question, just type it in the Q&A. That's the best approach. Uh, I guess coming back to the impact this has on your various aspects of your life, what was the impact of on your work life? So Raju, do you want to go on that first? How did your company
Yeah,
support you, and how were they
mm,
supportive?
yeah, yeah. Uh, due to Parkinson, my hand is sorry. I'll start. I'm working with a shipping company
Right,
and handling the customers' mail. They are not some mails. So due to Parkinson, my hand is swimming, my typing was slow, so that my email response was very less. So from I was getting escalation from the office that we, we are not getting the on time the email reply.
right,
So so I informed my team leader that this is the things. So he proactively told me to bring the reports, and we submitted to the HR, and HR and my team leader said that we will move from the email and put in the reports handling. So there is not the time you can do it, do it. You can do it. So we have submitted our reports to my
Raj,
HR.
Raju, there's a bit more disturbance coming in from your phone. So just see if you can
Now
carefully. Yeah, okay, go ahead.
so my team leader and team leader and supported me a lot with spoken to HR and also supported me the support that they have changed me the team. Internally they have changed it and given 50% task than the people, regular colleague.
Sorry, Raju, will it come back to you? Maybe Sunil, you can go and talk about this first. Raju will come back and you can continue your answer and see if it gets better at that time. Sunil,
Okay.
Okay.
yeah,
Yeah. So basically, for me, what it was, I was in a new job, barely 2 months old when I got diagnosed, and
right,
I thought he was kind of okay. My initial symptoms were just limp, so I could manage, telling people what was wrong. They would say for 2 months, I had a
Sunil,
fall.
can you look at the phone, please? Sorry.
Okay, sorry.
Yeah,
It's a bit of the Parkinson, so you'll have to bear with
I
me.
know, I know. Sorry.
Bit disco-ish. Yeah. So basically, I said, I was saying it was a new job, 2 months into it. I told my boss it was fine. And initially it was a limp. So I could tell people that, I just had a fall and it's kind of getting better. Because telling them at the start and explaining to them about Parkinson's was going to be a big headache. And even I was hoping that the diagnosis initially was wrong. After all, it was a clinical diagnosis, and even the medicines were not helping initially, as in they were not showing any relief to my symptoms. So, but then with a little bit of time, the limb became a little bit more prominent, and my confidence level started getting a little lower, and it was impacting my performance. So
Right,
within 9 months in 2013, I quit my job then, And since then, I've really not tried very hard to get into a job. My symptoms are slowly getting worse, and my motivation to do a job has kept getting lower and lower. So I
Mm,
have just not full time again after that. I'm at home since then, full
okay.
time. I've done some
Right,
part time, not really full time again into a job.
right. Thanks, Sunil. Raju, do you want to quickly try if your audio is better now?
Hello,
Yeah,
it's
go
okay.
ahead. Yeah,
Yeah, as I said, I was handling the customers' mails. So due to Parkinson, typing was slow. My team supported me and they submitted my reports to the HR. So they have moved me internally for the reporting and given me less target as a 50% target given
right,
within the team.
right,
And my cluster lead uh, advised she one day she saw I was walking very slow, so she told me to come meet me. So when I went to her, I told that she don't worry, if you need any help, you let me know. Anytime you can come. And she told me that I will start with the training. So 1 2 weeks she has been giving 9 to 10 after hectic schedule of her, 9 to 10 she was doing training to me. And also she has started once in a week in office only training. And I'm the only person who is below team with the other 10 people, more than 10 people. They are more than means
okay,
team the manager. So we used to have one week once we like 10 exercise we have to do exercise. Then we do meditation for 10 15 minutes. Then after that same exercise we have to repeat that once in a week again. So I'm very lucky to have such kind of to
right,
work.
right. So you have a fairly supportive work environment where they have, uh, you know, made adjustments to the kind of work you do, and your managers and team leaders have supported, right? So that's really nice,
Yeah,
and it also is indicative of the fact that this can be done, for other people as well. Um, Monica, if you would like to, especially as a woman's perspective, if you want to share a bit about how this has affected your personal life, the effect it has on your children, and how the support from the family has works and doesn't work. Monica, you're on mute.
Once,
Sorry, go ahead. Go ahead. I
my
already
family,
unmuted you.
okay, my family is very supportive about it. They initially, the moment they came to know that I'm having Parkinson, each and every people of my family, be it my brother, my sister, my brother-in-law, they tried and got as many information as possible from their end to help me cope up better, to educate me, since none of us nor anybody in my family had this disease. So we were really not aware of what problems I can face, what are the treatment or different avenues that we can go through. So they helped me finding out that. Secondly, I was fortunate enough to have a doctor friend of mine who noticed the tremor in my hand, and she asked about it, and I said it is Parkinson's. So she's a very good friend of Dr. Nicole, who is working for PDM. So in the first month of my diagnosis, I was lucky enough to get in touch with the center. So I went and met Dr. Nicole. She told me that I'm doing very good in terms of my reflexes and all. And she assured me that it is not much of a problem and I could live a normal life with by doing certain things regularly. Then I met Dr. Bijal from
Mm,
PDMS because Dr. Nicole had referred me to her for counseling. I had
right.
certain my brain relating to my personal life and professional life and all. So even she counseled me very nicely to forget scared about the past, because if you keep your past in your head, it is very difficult to go ahead on the road of recovery. So her suggestion was to clean my brain, to come out of all the thoughts and just to concentrate on myself and my life, because that is too important. My husband was supportive in terms of, money, finances. Like if I want some further tests to be done, since it was there on the paper, clinically diagnosed with full proof, then to somewhere down the line, I was feeling that might be there is some mistake or something. So he came upfront and told me that there is no problem. If you want certain more tests to be done or repeat the test, he was ready for it. This
Right.
was the support that I got from the family, from the doctors, and my house. In terms of reaction on my children, it was very bad, because initially 2 months I was just running behind the doctors at that time when I was diagnosed 2 years ago. My
Right.
daughter was years old at that time. So, she never could find me or my husband in the house. We used to leave the children with the neighbor, since my family stays a bit far away from the place. And they have their own children going to school and all. So I used to leave my children with the neighbor so that I
Mm.
could go to the doctor. Because once you leave for the doctor, it takes minimum 4 to 5 hours for you to come back to your place. So, like, my daughter used to always wonder, and immediately I was put on allopathy medicine, the Syndopa and all those stuff. So that had a very bad reaction on me, the side effects. I used to suddenly get angry. I used to suddenly get wild. The tremor used to all of a sudden flare up. So my children were really scared of me. But then
Right.
slowly it sunk. It took at least 15 days for them to understand that there are certain periods in my daily schedule wherein I get angry. Still now they are small, they don't understand, but okay, they have set up in their mind that there are certain time when you should not go in front of mama, because she will just shout, because they don't know the reason that the medicines are flaring me up. I'm not able to hold myself properly. I used to
Right.
feel that I'm walking on the clouds and all. So suddenly my daughter just wanted me to cuddle her and all. So, I was going through a different trauma because of the medicine impact on me. So, I used to push her, which I had never done. I just wanted to tell her to go away, but, like my heartbeat used to go high. I couldn't breathe, and also I didn't have the strength to even tell her that, look, I'm not keeping well, please be away. Instead of, because I didn't have that energy in me, I used to just push her. So
Right.
she used to cry for some time, but slowly even she understood. And now, since I'm on minimal medicines because of my different management tactics that I have applied in my daily life, I'm better off. So
Hmm.
now they don't know Parkinson's, what it is, what affect and all, but okay. The moment there is tremor in my hand, they know that they have done something which has caused, so they just go away from me, or they just stop doing
Hmm.
some. So now I think it's too early for me to make them understand. So I'm just going
Okay. Thanks. Thank you, Monica.
living
Yeah, I think we're losing you,
one day at
Monica.
a time. I think
Yeah.
when they are 12,
Right. Right. Thanks, Monica. Raju, you want to try again, and we hope that your audio is better in terms of, how did your family react and how has it affected your personal life?
Due to Parkinson, I became very slow to get ready for the office because taking bath takes time to. It's audible.
So I think if you speak louder and slower, it's probably better.
Okay, I become very slow due to Parkinson to
Right.
get ready for the office because thing is that while taking bath it take more time than before. So eating also very slow. Night time while eating, people all eat, my family members all eat, and they are waiting for me to finish the eating and start murmuring. do fast eating, so we can go for sleep.
Right.
Uh, sleep. Always comparing me with my past life,
How you were
how I
before.
was pretty,
Right.
how
Okay.
and also said that when I was 5 years in Dubai. So also they were saying that when you are in Dubai, you are alone. You are not there. So you drink daily.
Mm.
And while coming back there, you not drink. You have to drink because will shout at you.
Sorry,
That's why you
Raju.
got this.
Sorry.
Hello.
Yeah. When you say hello, it's fine.
Audible also fine. So when I was in Dubai, 5 years I was in Dubai. So my parents said that when you are in Dubai alone, that time you might be drinking daily.
Right.
And after coming back here, you stop your drinking. That is the reason you got
So they assumed that you were drinking and these were like withdrawal symptoms to your drinking rather than Parkinson's. That
yeah,
was the
yeah.
assumption people were making.
Mm. And I can't eat the food with the spoon. So
Right.
in spite of giving order, I, I started eating by my hand.
Hand. You
So
started
they
eating
said
with your
that
hand because eating with the
you,
spoon was problematic. Yeah. Okay.
yeah, so in office we once or twice in a month we order food, we collect money and order food from the other from home and we gather eat together with the food. So I can't go in and get the food for me. So my friends are there. I request them, please bring me food. And because my hand is shivering, so I can't take with the spoon anymore. So they bring me and I tell them that I'm feeling very guilty. So let's go over there. For you, we can't do this thing also. This way, my personal life is better. I was feeling that people I have to take help with people. That's it
Right.
for this question.
Right. Okay. Thank you. Thank you, Raju. I think let's also take a few questions. We've got a bunch of questions that come in. So let's first quickly take them. Nicole, I think there's a couple for you as well, and to any of the participants as well. So one question is, uh, I am 68 years, diagnosed PD last year, doing physiotherapy at home with 1 kg weight under advice from the hospital physiotherapist. I'm very comfortable. Can I increase weights to 2 kg? Nicole,
Yeah,
can you?
yeah.
Yeah.
Yeah, so a person who's diagnosed, just to clarify, is that a person who's diagnosed when they were 67 is not young onset. But
Mm,
regardless if you're young onset or older onset, where exercise is concerned, vigorous high intensity exercise is actually where you get the best benefits for people with Parkinson's, not simple exercises but high intensity. And one way of increasing the intensity, one is speed, by increasing your speed. The other is by increasing the amount of weight you take. So if you find that and I don't tell anyone to just start with a high intensity exercise first just because it's good. You need to go gradually. So if you find that the weight you're using, which is a 1 kg weight right now, is simple, you should in fact take a heavier weight and move forward, because that would be much better for you.
right. Okay. Um, there's one question. मेरी fingers दो wheeler two wheeler चलाते stiff हो जाती हैं. I'm very sincerely doing exercises. I feel my hands are becoming weak day by day. Depression is my main symptom.
So in terms of, you have to be very careful when you're driving a vehicle, not only for your own safety, but for the safety of other people on the road as well. So if you are having difficulty, you can try with the exercises and the medication. For the hand exercises in particular, if you want something to improve, there's something called specificity of exercise. तो अगर आपका हाथ ठीक से नहीं चल रहा है, फिंगर्स ठीक से नहीं चल रहा है, तो उनका ज्यादा एक्सरसाइज करना है. फिंगर्स के लिए भी स्ट्रेंथनिंग एक्सरसाइजेस होते हैं. अगर आप सिर्फ शोल्डर और पैर का एक्सरसाइज करेंगे वो अच्छा है ब्रेन के लिए, लेकिन फिंगर्स के लिए अगर वो इंटेलिजेंस आना है आपके फिंगर्स में, स्ट्रेंथ आना है फिंगर्स में, तो स्पेसिफिक एक्सरसाइजेस है फिंगर्स के लिए. तो वो आपको थोड़ा हाई इंटेंसिटी फिंगर एक्सरसाइज करना पड़ेगा, क्योंकि अगर आपको स्कूटर पे आपको मतलब वो गियर्स चेंज करने में आपको तकलीफ हो रहा है, तो वो स्पेसिफिकली आपको वो करना है. डिप्रेशन के लिए आपको काउंसलिंग करना है, उससे बहुत बेनिफिट भी मिलेगा. So I think it's really important that people should not be scared of going to see a counselor. Counselors
Right.
are very helpful. They help you to see things differently, and I think that's very important if you want to live a better life with a condition.
Right. Right. I think on that, I'll also come back to you, Monica, because you're talking of a few symptoms. Monica, can you talk about how you manage your symptoms and how it affects some of the daily activities that you do, and how do you work around with them?
Yeah, okay. Like the symptoms earlier, they're not so bad, but now since 2 years have passed, the symptoms are more conscious, and I have to think and do things. Now it is not that I can multitask things. Suppose if I'm cooking, earlier, like I used to do. I never used to prepare things and keep. I used to just manage some chopping, and with my next hand, with my second hand, I used to just do the other work,
Mm,
like getting the masalas and all that. But now, since that is not possible, because at times, I don't remember what I have to do.
right.
Secondly, the active hand, which is the right hand, is affected. So it takes time to pull back your hand. So,
Right.
I have to consciously do one act at a time, think before doing, do the preparation well in advance for all the tasks, what needs to be done. Like, I have to literally plan my cooking, which was never done before, like a thing. They just go start cooking because one after another things falls in place. But now, because 2 years has passed and I'm not so fast in my movements, my
Mm,
hand doesn't uh, work so fast. So I have to keep everything ready in a chronological order. Like this will go first, this will go second. So I have to
right.
keep all the ingredients ready on the table and then do one thing after another.
Right.
Secondly, I write down a checklist when I get up in the morning that okay, this activity needs to be done first, then second, then third, because there are times when I forget things and by the time I realize that it's too late. Second, I start early because now it takes the same activity which used to take 5 minutes before. Now it takes literally 20 to 25 minutes. So I start early so that I complete the task on time. Task as in suppose if I need to cook and the food should be ready by say 1 o'clock. Earlier I
Right.
used to start cooking at 12:30, 1 o'clock it used to get over.
Right.
But now it is 11 o'clock. And
Right.
then I plan my activities in such a manner that I can do two things at a time. Like I have to lead my daughter to her classes, her maths classes, abacus. So what I do is I start cooking early. I finish the cooking. I take her to the classes. She's inside the class. There is a room where I can sit. So I sit over there, either do my meditation or do some exercise because it's an empty room. It's a
Right.
classroom.
Right.
They do in the class. So when I go, even when I go for my yoga classes in the morning, I walk so that my walking is also completed and my yoga is also done. Like I walk through and through. So I just plan
Right. Right.
everything in advance.
Right. Right.
Otherwise,
Okay.
like if you get stuck with something in between, between the nervousness and the self that you undergo is tremendous. So it's
Right.
better to plan so that you have that satisfaction that you have completed and you are no different than other people who are.
Correct. Correct. Good. Thanks, Monica. Sunil, do you want to talk about how you manage some of your symptoms that cause challenges?
Yep. Yeah, I'll go with the
And
symptoms.
there's been a request. There's a request that you speak a little louder, please. Sorry.
Okay. So I'll go with my symptoms. I hope this is good enough.
Yes.
Uh,
Thanks.
my symptoms pop up when when I'm on the pill, I'm okay, but when I'm off the pill, that could be 2.5 hours. The limbs that get tired, my arms thing, I can balance while standing, move backward,
Sorry,
forward.
Sunil. Can you look at the
Fast.
phone? Sorry.
No. Am I too fast? Can you
Now,
hear me?
yeah, now it's okay. Yeah.
So I was just going through my symptoms, which are plenty. Can I go through them?
Sure.
So it's basically the limb gets back, my arm swing goes, I can't balance while I'm standing. I keep running around the house. When I'm sitting, I fall to one side. My handwriting is bad. My speech is hastened with my I search. I can't watch back. I can't eat. Stiffness, rigidity, freezing. I get stuck. It's very funny. In fact, if people are watching me when I'm sitting, when others are talking, I'm kind of fidgeting around because I can't concentrate. I get irritated quickly. So the symptoms of Parkinson's are like motor, non-motor. So you got constipation, you get moody, you get negative, you get angry.
Mm.
But this is all off. And how do I manage them? Is when I'm off, I try not to be outside. I'm basically inside. I prefer to relax. I think read, pray, divert my attention, stay positive, and keep focused on something that keeps me, something that I can be passionate about and have a drive in life, basically. So that's the way I manage my symptoms.
Right.
When I'm off, I can't think about it.
Right. Right. Okay. Thanks, Sunil. Uh, Raju, is there anything about your symptoms? This was earlier question 7. Is there anything about your symptoms that you want to share?
Yeah. While at home, my writing I can write good, speedily and clear, good handwriting.
Mm.
But when I go to the bank, my daughter's school and all, when
Mm.
they tell me to write something, that time I can't write one alphabet or two alphabet. So when
Right.
I write it, people is when you send the message from your home, your writing is too good. Either this is wrong or that is wrong. Might be
Mm.
a writing to someone else. So I told them that okay, you come to my house, I'll write that to you.
Mm.
Because in that way, and second thing, I'm a PTA member to my daughters. So we conduct meeting and all. While I handle all 60 parents, 60
Right.
parents, any information from you, school, we, we have to inform to the our parents. I make the question and sometime we make the full question set, not question set, question set that I the subject I take and I made it clean. People used to take one subject and make it. The concept behind this is that if anything lost or theft or means paper they are not finding, so my answer question and answer set will be we will have everything in that like textbook, notebook, and all. So for that we conduct meeting. So while keeping the meeting, I tell my teacher to you you explain these things to them because I can't explain. So meeting means what actual put put the round and we'll keep the. So while everybody is saying why on phone you're speaking, no, I was so that's why I'm okay, no problem. If you need any help,
Right.
these are all
Okay.
things.
Sorry, Raju. Still a lot of problems. Okay. Thank you. Um, Nicole, let's take a couple more questions as well. One question is, I am 60 years old and suffering from Parkinson's since it says 1911, but can't be 11, must be 2011. Nowadays, I have too much tremor in my right leg or foot. Within half minute, it comes in full body and I'm unable to do anything. It remains for 1 hour or more or less, but when I'm okay, I will do everything. How do I manage that situation?
Yeah, so I'm just there. It does happen that sometimes people mistake a tremor from something called dyskinesias. I'm not sure because usually the tremor you'll find either in the jaw or in the hand or in the leg. But if the whole body is moving, that is a dyskinesia, and they're both involuntary movements. So I'm not very sure exactly what he has. So usually the tremors actually quite dependent on the dose. So when you do take your medications, you'll find that the tremor does become less for the period when the medication is working. But it can also increase when you're very anxious, when you have to do something in a hurry, when you have to do something which is a bit stressful. You will find that the tremor will increase, but primarily the tremor is dependent on your dose. But if, as you're saying, that it takes over your whole body. So sometimes with dyskinesias, which are these involuntary movements of the whole body, you can start off only with the leg or the hand and then move to include your body. That can actually happen during the medication time. So you can have an on period dyskinesia. And for that, you would need to talk to your doctor and get your dose altered, or maybe they could give you something else like a mantidine or something like that to reduce the amount of dyskinesias. So there are two different strategies for both, and it's first important to understand what exactly is the issue.
Right. Okay. One question to the participants. Has any of them done DBS? And I guess not, but if anybody, did you consider it? Did your doctor talk about it? Did you ask your doctor? So if you have anything to share in terms of whether it was an option and, whether you did not, the decision making on that. Sunil, you want to take that?
Yes. So, doctor has spoken to me.
Uh, can you speak louder, please?
Yeah, my doctor has spoken to me about it. Can you hear me?
Yes. Yeah, go ahead,
Okay.
Sunil. Yes, go ahead.
Hello.
Yeah, we can hear you.
Sorry. So my doctor has spoken to me about it, but not that I have to do it now. But he keeps telling me you better start working so that you can have enough money to spend on the operation later on.
Hmm.
So not an option as of now.
Okay. Okay. And
Hello.
Monica, yeah, got it. Thanks, Sunil. Did you discuss DBS or did the doctor discuss DBS with you?
No, the doctor has not discussed DBS with me, but few days ago I just read about it, and I don't think so it's a very good idea to do it
Okay.
because
Thanks. Thanks,
yeah.
Monica. It's okay. Yeah, thanks. Um, so, Nicole, couple more questions on symptoms. How do I deal with freezing? And another person, suddenly my both fingers get numb and hand finger, some uncontrolled.
Okay, so for the first question, coming to freezing, there are many strategies actually for freezing of gait. It's a sensation of where you feel that either you can't start your movement, start walking, you feel like your foot is stuck to the ground, or whilst you're walking, you find that you get stuck in the middle and you can't move. There are various strategies which a therapist can teach you. They range from something like sound cues, which is 1, 2, 3 step, to visual cues, which could even be a laser cane. You have different ways. You can use a metronome, you can use beats of music. There are different strategies which you can use, but you need to find the strategy that suits you. And so it's good to do a trial of a few. There are, at the Parkinson Society, we do have a lot of information about that, so we can definitely help you. But if you do have a therapist, you can look online for strategies for overcoming freezing. We have seen, in fact, very interesting ways in which people have overcome freezing on their own. In fact, we sometimes incorporate those ideas as well, that someone throws a ball and just bounces a ball
Mm,
whenever they get stuck, or like, using an upturned walking stick or dropping a handkerchief. But people come up with innovative ways, and I think a lot of the physiotherapy is based on people with Parkinson's finding solutions in their daily activities, and then we kind of learn from people.
right, right.
And the
Right.
second, I think, was the numbness in the fingers. I think the numbness, and you do get numbness and tingling in Parkinson's. Sometimes, usually when it's finger related, I also feel it could be a neck problem, which is causing a compression of the nerves. So I think you would need to get that checked and see whether it's a neck related problem or whether it is actually numbness because of Parkinson's. And for that, then only the medications would be able to help you per se.
Right, right. Okay. Here's somebody who's 43 years old, has Parkinson's for 5 years. I can't sleep at night. I don't feel sleepy, and if I try to sleep, I start getting back or arm pain. Even if I don't sleep, I don't get sleepy the next day. Um, any of you, Sunil or Monica, have faced similar issues? Um, before we go to Nicole on that.
Yes, actually, I have faced this particular problem, and
Mm,
I spoke to doctors about it, and I spoke to my yoga teacher also. So,
mm,
like the few things that I do before sleeping is like once I wind up all my activity for the day, I take a lukewarm water bath which soothes certain nerves. Then I dimly lit the room. I hear
mm,
to some soothing music. I see
mm,
that my bed is flat and there is no budge or anything on any side of the bed. It is completely flat and there is some open space, like no pillow is going to hit my hand or what, so that I can turn around freely. And I tried counting numbers. Initially, I tried counting numbers backward because this is what she had suggested me, that count numbers backwards. So at times I used to start from number 500 and go till say 200, and the any moment I used to drift in sleep.
mm,
If that is not working, then I started noticing my breath.
mm.
Noticing breath is a bit difficult, but it's a good technique to fall asleep because the pattern changes so often that you get confused and you just drift in your sleep.
Mm, okay. Um, thanks, Monica. I guess there's one quick question. Somebody wants to check if they can take a very small amount of wine once a week. Nicole.
But to be honest, I think you need to first talk to your neurologist based on for that. There is, I mean, one glass of wine is not considered to be bad or to affect you, but it also depends on the severity of your condition, how long you've had it, and you also need to see for yourself whether taking that one glass of wine, affects, like, people with urination problems, or people if you see that there's a change in how your body is reacting. Then I don't think that you should. But always, before, you could ask your neurologist. There is no one glass of wine shouldn't be an issue unless it really affects your symptom, and then you
Okay,
should accept that and stop it.
right. Uh, Raju, I'm
Can I take
unmuting
that as
you.
a non-doctor?
Yeah, yeah, please go ahead. Experience always helps. Yes. Sunil, go ahead.
Go
You'll need to speak
don't
louder.
worry.
Sorry,
And
go
enjoy
ahead.
fun.
Like, go ahead and glass of wine, preferably home. Don't worry at all. Just enjoy life.
Right. Okay. Raju, you want to add to that?
No, Sunil has covered it.
Okay. All right. So we've got a couple of people saying go ahead. All right. So that brings me to the next question. I think it's a good lead in. What is your approach to handling social obligations? Parties, social engagements, meeting friends, weddings. Do you still go ahead and do those activities, or has Parkinson's affected your uh, approach to handling these social requirements? Monica, you want to go first?
Okay. Actually, I have stopped going to social gatherings and all only because of the fear that people will judge me and then question me and they might gossip about it.
Mm,
So now, like, I go to parties and to christenings or weddings only if it is of a close family member. And what I do is before going over there, I inform the people who might question me well in advance that okay, I'm having this problem and there is nothing much to worry about it. I'm doing fine. So that I'm happy that nobody will keep on shooting questions at me. And
right.
if I have informed all the people with whom I have to work or meet regularly. For example, the school teachers for my children's misbehavior, because since now I don't pay much attention because it stressed me out. So, like, I have gone ahead, informed the school teacher that excuse them for some few months because I'm not paying attention on them because
Mm,
it flares up my conditions. So,
right.
whoever needs to know about it, I go upfront and tell, and after that, I'm at peace. Like, I don't have to pretend, I don't have to hold my hand very tightly so that it doesn't tremor.
Right. Right.
I
Okay.
have told only people who are important to me, my friends and all, who are really worried about me. I've informed them. Rest, I don't think so. I need.
Right. Okay. Thank you. Um, Sunil, do you want to?
Yep. So basically, outing friends and parties, small parties, meeting up with friends, I've not stopped. I do everything. But if it,
Sorry, we just lost you on the last sentence.
I said if it's small parties outside, lunches and dinners. But if it's a wedding and other occasion, because I need to do my entire activity outside. I got to be out all the time and party, be spoiled sport and not have fun along with everybody. So it's better to go into a party. So if it's like a very close relative, I'll go, but otherwise I won't.
Okay.
Because I know people that I'm not coming because they don't understand my off side. They think
Right. So just to, because you were going in and out, just kind of paraphrasing. So you go for, uh, you meet small groups and not the large ones, and you pick and choose on stuff like weddings based on, how close you are to the person concerned.
because
Because people don't understand your
yeah,
offside and the challenges of your symptoms. Okay.
true, true.
Thanks. Raju, do you want to answer that question about handling social obligations? And you do also have work get-togethers and work parties.
I can share. Whenever relatives friends come to know that I am having Parkinson, they become the neurologist.
Mm,
They start advising to this. You'll get cured because one person we know that he has done this. So many people come and so many advice,
right.
and to follow all those things, we to we get irritated.
Mm,
So straight away when relatives and friends come to talk to me, I tell that please don't touch the topic of Parkinson. apart from that, you can speak to anything.
Right.
So they
Right.
tell why you're you know, because not only you, so many people are coming and asking me. This is no, it is curable. People start arguing it's curable. Okay,
Right.
it's curable. Okay, keep it with you. It's curable. And and we
Right.
have one thing that I said already, biryani party.
Right.
I eat with hand and so we have this one. We have annual party, something around January. February. We have annual party. I'm working with this company 9 years, 8 years continuously. I have attended the annual party.
Right.
This is the ninth year. I have not attended the party. Annual party. People were shocked.
Right.
Means, not due to Parkinson. It was not due to the Parkinson. I have one. I have last one disease called behavior disorder. So at least give me 10 minutes. I can speak about behavior disorder.
Okay.
So
Thanks.
and when I don't went to the picnic and all, which they people will surprise why you are not coming. We will take care of you. No, I told no, I can't come because I know what is my problems, so I can't come.
Right.
So about behavior and other, I will discuss. This is the that's it for this question.
Okay. Thank you. Thank you, Raju. Um, so I think there are a couple more questions that have come. One is one is somebody who says my body gets stiff and I have falls 4 to 5 per times a day. He is 66 years old and has Parkinson's since 2011. Any thing that you want to add to that person, Nicole?
So if you are having repeated falls, one is you should definitely go back to your neurologist. Maybe the dose needs to be changed and adjusted. And also, physiotherapist is very important in this condition because one thing we have to do is prevent the falls because of the damage that it can do.
Hmm.
Uh, and there are many things that we do. One is something called a falls diary, which is to kind of every time you have a fall, you need to see where you've fallen, what time you've fallen.
Hmm.
Was there a reason for it? Was it, did you suddenly feel dizzy or did you trip over something or was it in your off period? And
Hmm.
we first kind of try to see whether there's a pattern or a trend in what is making you fall. For a lot of people, it's just the turning movement, and every time they turn, they have a fall. So that's the first thing that a therapist would do would be to actually try and understand whether there's any pattern or trend and change and try to modify those things first. And then the other process is strengthening and balance and making the person aware that these are probably the hot spots where you could have a fall or during these activities, and just making more them more aware of the risk of falling during certain times and in certain spaces.
Right.
And
Right.
how you deal with falls. Yeah.
Okay. There's somebody else who says मैं 40 साल की हूँ and मुझे 14 साल से पार्किंसन है. मेरी 1 साल पहले DBS हो चुकी है. मुझे हेल्यूसिनेशन की प्रॉब्लम है. इसके लिए मैं क्या कर सकती हूँ? This is somebody from Bhopal.
ओके तो हेलुसिनेशंस के लिए जो भास बोलते हैं वो दवाई है, तो आपको डॉक्टर आपके जो न्यूरोलॉजिस्ट है उनसे बात करना है, तो वो आपको हेल्प करेंगे थोड़ा मतलब अलग अलग टाइप के दवाई होते हैं उसके लिए। अगर आप एक साइकोलॉजिस्ट से भी बात करते हैं, क्योंकि हेलुसिनेशंस में भी कुछ इंसाइट होना चाहिए, क्योंकि कभी कभी ऐसा कुछ जैसा शेर देखेंगे या कोई आदमी आपके घर के अंदर आया है, तो वो साइकोलॉजिस्ट आपको बताएंगे कि कैसे आपको कोप करना, आपके फैमिली भी ये जो आपके साथ रहते हैं वो मतलब उनका रिएक्शन कैसा होना चाहिए, वो आपको कैसे हेल्प कर सकते हैं। So I think for hallucinations, it's important to talk to the neurologist and have change with the medication, but also to meet a psychologist who will help you cope with hallucinations. So sometimes it can be very scary as well. to experience that.
Right. Okay. I am 66. Suddenly, from February 20th, day by day, I lose writing. Now I can't hold pen and write and sign. Yeah, I think pretty much everybody's talked about writing getting affected, but anything that you'd like to add, what they can do as practice
If,
or something?
sorry, did you say it was sudden? Did you say it was sudden?
It says from suddenly from Feb 20th, day by day, I lose writing. Now
Okay,
I
day by
can't.
day. Okay.
Yeah.
Okay, day by day. So that actually is a symptom of Parkinson's where, especially the fine motor movements like writing, those do get affected. There's something called micrographia, which is where the letters become smaller and smaller and almost legible. At the end of it, even signing can be difficult. So once again, I said that the specificity of exercise is important. If you want your writing to improve, you need to practice the writing. One way is to first strengthen the muscles, especially strengthen these fine movements, these pinching movements, but also to use a red and blue line book. So you have to learn to write big. It's important that if you focus on a task, so for people with Parkinson's, doing multiple things at a time can affect the way that they perform a task. So if you're writing, you focus on the writing, and there is a program called LSVT Big, which says that you have to keep saying big when you're writing. You have to keep telling yourself that you need to write big, and your writing will be the normal size. So definitely, if there's a weakness and you feel you can't write properly, you need to strengthen. There are certain modifications like using a thicker diameter pen and other ways that an occupational therapist or a physiotherapist would be able to help you modify your writing.
Okay. There's a very general question. I don't know whether it's something, it's quite wide. Somebody's asking, is 67 and Parkinson's since 8 years. Wanted to know about symptoms and effects of medicine. It's very broad. I don't know.
I mean, yeah, so it's a very, very long list. One thing that you should know is that the basic categories of medicines, the syndopa, which is very common, is the one where they're putting in that levodopa, or the dopamine which your body requires. A lot of the other medications, like dopamine agonists, are the ones which boost the dopamine that you already have in your body, and they
Mm,
help to just boost that to make it work better. So those are the certain types of medications that you have. One where you're actually putting in that levodopa dopamine, and the other one is where you're boosting what you already have. And then there are certain medications which help to control certain symptoms like the hallucinations or the dyskinesias. And it's different for young on the types of medications are different. The starting medication at least is different for young onset, and it's different for older people, and also varies actually based on this, like how much effort you need to put in your work and daily activities. So there's a lot of information online if
yeah,
you
so
want
I
to
think.
know about medications and their effects and their uses, and there's lots of information.
So I'm just conscious that we've been at this for 1.5 hours. So I think we should wind down. I'll just ask the panelists the last question as to, how do you, your advice to others and how do you cope emotionally? So I'm just going straight to the last question. Monica, do you want to go first?
Okay. My advice to people with early onset and adult Parkinson is that try and live for the day. As far as possible, try to keep your mind blank. Don't try to question yourself why it has happened to you and all that. It's okay. It has happened. It's okay. It's very much okay. You are still alive on this earth. You are still there for the people who are important for you. They don't want you to be working or walking. Only your presence itself matters a lot to some of them. For example, my daughter, who is so young, even though I feel tomorrow if I'm not able to do anything for her, she will still be happy in school. So don't stress yourself, because if you stress yourself, then you will face problem, and looking you in pain, your family members will be more tensed. So try and live for the day and be happy that you're alive.
Right. Um, Raju, do you want to answer the last question?
Yeah. First of all, I would like to add up that accept the truth that you are having Parkinson. Don't hide it. If you try to hide it, it will more impact to you. So don't lose your confidence. Parkinson is, if you eat the tablets regularly and do the exercise, you can control it. You can control yourself and live the life normal life. The medicine properly check with the doctor and follow the medicine with doctor advice. So it is the best key for living normal life. And don't take stress that I'm having Parkinson, I'm having Parkinson. Do think that other people who, other people like people, some people are blind, some people can't eat food. So we don't have any, I don't think any restriction for eating food, going out and all, unless and until we the effects are there.
Okay.
So if you want, can you give me 10 minutes so I can describe behavioral or disorder which I have I had the experience on last year.
Thanks, Raju. Sunil, do you want to share your advice and how do you cope?
Yeah.
Sunil, can't
Can
hear
you
you.
hear me?
Yes.
Can you hear me now? Can you hear me?
Yes, when you come closer, yes.
This one is this one?
Yeah, this is fine.
Okay, great. Okay, so basically, I'll take the emotional first and then the advice later.
Right.
On the emotional bit, I think for us to be able to do anything which we could do earlier is a lot by the three P's. One is
Sorry, we are losing you,
be
Sunil.
positive. I said need to work on my emotions. I focus on the three P's.
Mm-hmm.
That is prayer, and then and finding passion to do something that keeps me driving, gives me the drive, basically.
Right.
Yeah. So that's the emotional bit. To the advice part, on advice, we are, you know, uh, say, heard or right.
Sorry, we are lost you on the advice. We're losing you on the advice.
Yeah. So I want to. Can you hear me now?
Yeah.
Yeah. So basically, what I'm saying is, when it comes to advice, I'm not the best person, but I will still say a few things. One is in Parkinson's are at different stages and at different symptoms, right?
Mm-hmm.
Yeah. So the ones who are still is not yet known, I can really say that the prayer and the are the ones who need to even get there. But for the ones whom still is still helping, even there, I'd say each one is different. Each one has a different DNA, so it's difficult to advise. But two things that I'll still say is one is we need to remember that we are very strong people. It is not easy for somebody with PD, to understand what we are going through. It's very difficult for somebody who doesn't have PD to understand what's happening to us. So we need to remind ourselves that we are the stronger ones and do things that make us happy. So whatever you want to do in life, do it. Use your brain more. Be positive because the brain is still working. Be with people who understand you and whom you can make understand. These are key things. And the most important thing that I say is actually not advice to the people or the people with Parkinson's. It would be the caregivers is for them to understand what PD is, to understand what their person with Parkinson's is going through as a PD patient. That's very, very important.
Right. Right. Okay. Thanks, Sunil. So we'll quickly wind up. I think, Nicole, you wanted to share a few final points as well. So let me just quickly share that screen as well. So go ahead, Nicole.
Yeah. So actually, just in summary, and I think everyone spoke really well about their lived experiences, and a lot of it is what we've learned from talking to other people with young onset Parkinson's. And these are just tips. It's not easy, but if you see a lot of people who learn to schedule their day and learn to deal with a different attitude, can actually live well. So the first thing is that healing starts with acceptance. Acceptance does not mean giving in. It means accepting that it is part of your daily challenges and moving on. I think it's very important that people reach out for support to the right health professionals. Take in your family. You need the support now and later. Support groups are very helpful. The Parkinson's Disease and Movement Disorder Society has a young onset Parkinson's group, and Sunil actually has been great in trying to set that up and keep it going. Talk to other young onset people with Parkinson's and reach out, because the more you learn and the more you talk to people, the more you will be able to deal with it better. I think exercise should be a priority, and high intensity exercise. And just a few things which I think a lot of them did cover in terms of how they deal with it. And one is with employment. Disclosure is a personal choice. If you are able to fill the role and do your role well, you don't need to disclose it. But if you feel that you cannot deal with the situation like Raju did, don't just quit. Okay, there are always options, and you can talk to your manager. And it's advisable to have a backup plan for the future, whether it's another side business or another business, or your spouse having a job. It's always good to have a backup plan. Where finances are concerned, no one expects to have Parkinson's, but you always need to, at this point of time, reevaluate your financial state, especially your debts or any loans that you've taken. Factor in the economic cost of dealing with Parkinson's, and as like Sunil, the doctor told Sunil, that you may require surgery later on, and that's quite a big cost, so you need to factor that in, and also look at your insurance. When it comes to family planning, for those of you who are probably much younger, in your late 20s or early 30s, don't be worried, because pregnancy is possible if women are taking birth control pills and their Parkinson's pills, and they should talk to the neurologist, because they need to make sure that the dose is right. When it comes to parenting, I think Monica did an excellent job in terms of explaining to your kids without scaring them, uh, preparing them so that they are independent. It's also important to restructure your roles and responsibilities at home. The tasks that you can't do, you need to give them out to somebody else and take on tasks that you can do. And also create a human support system. Like Monica said, that her neighbors are the ones who will look after her kids when she needs to go somewhere. And lastly, it's relationships and marriages. Relationships are hard in general, but when you have a condition, you need to be honest and open, whether it's with your family or with your spouse or with your partner, and work together as a team. You need to pick up slack of the other person whenever necessary. The more you communicate, the better it would be. um, yeah, but this is just a few tips that we've learned. And I think the last line of this is important, that Parkinson's, you may be in my life, but you don't own my life. And it's important to know that Parkinson's isn't your identity. And like with a good attitude, with support, you really can live a good life with Parkinson's. And if you have any questions, or you'd like to join the Younger Onset Parkinson's group, you can contact any of these numbers, and they will help you out with more information. Thank you.
Okay. Uh, Thank you, everyone. And, really thank you to Sunil, Raju, and Monica for sharing and talking about so many different aspects of your condition and how you're managing it. And I'm sure it will motivate and inspire others who need to get past the self stigma and the shame, and learn to accept it. And as Nicole said it beautifully, it's not about giving in, it's about recognizing that this is part of your daily life. And I think just one more tip on that, I think on the practical aspects, Parkinson's does get covered under the disability certificate as well, right, Nicole? So for
Yeah,
those of
yes, it
you,
has recently from
yeah,
2016.
yeah. So in case you need to do that, you can avail of that as well. And next week we are doing few more webinars on kidney in Bengali and Kannada on Tuesday and Thursday, and mental health on Monday and Friday. And as always, we are on Facebook, Twitter, Instagram, YouTube, and we also have an Android app. So thank you, everyone.